The NGO I would like to present for the Global Health Nursing class is Doctors Without Borders. Doctors Without Borders, also known as MSF, is an international independent medical humanitarian organization. It was founded in Paris, France in 1971. Today, it is based in Geneva, Switzerland, and has become a worldwide movement with 21 sections and 24 associations. One of these associations is Doctors Without Borders USA, which was founded in 1990 in New York City to raise funds, create awareness, recruit field staff, and advocate with the United Nations and U.S. government on humanitarian concerns. MSF's mission is to deliver emergency aid to people affected by armed conflicts, epidemics, natural disasters, and being excluded from healthcare. They reject the idea of third-rate medical care and offer assistance to people based on need, irrespective of race, religion, gender, or political affiliation. MSF begins by evaluating the situation to determine the medical needs before launching a program. They analyze what their presence could potentially bring. They aim to reach 4 of the UN Millennium Goals: to eradicate extreme hunger and poverty, to reduce child mortality, to improve maternal health, and to combat HIV/AIDS, malaria, and other diseases. As a humanitarian organization, they have helped draw attention to political issues. For example, they have denounced forced relocation in Ethiopia in 1985, or the Rwanda genocide in 1994. They have also advocated to lower the prices of HIV/AIDS and malaria treatments. MSF provides 4 types of services. They assist people in armed conflicts when hospitals and clinics are destroyed or are overwhelmed by a situation. They provide healthcare and support by offering operating theaters, clinics, public hygiene assistance, nutrition programs, epidemic control, and mental health services to people displaced by fighting or living in conflict zones. In case of a natural disaster, they move quickly to identify the needs, even though access is sometimes difficult. They have developed prepackaged kits so that teams can offer rapid life-saving assistance. In those cases, MSF can offer surgery, psychological support, nutritional support, and relief items such as blankets, tents, cooking, and washing materials. When an epidemic appears, such as cholera, measles, meningitis, or even HIV/AIDS, tuberculosis, or malaria, MSF is prepared to help. They have been known to collaborate with local governments and authorities to manage these crises. They work with the existing medical centers or set up new structures if needed, providing treatment and developing prevention programs. They have also been seen to provide vaccination campaigns for measles, meningitis, and inform the population of the risks to prevent further spreading of the disease. In case of social violence or exclusion, MSF provides medical, psychological, and social support to people unable to access health services. They encourage local authorities and civil societies organizations to improve access to services and increase social acceptance. Over the years, they have been recognized for their work and have even received the Nobel Prize in 1999. In many places, Doctors Without Borders have been able to have an impact beyond its immediate activities, reaching populations or pioneering the use of practice in ways that have far-reaching and lasting consequences. Their operations are mainly conducted by groups of expatriate experts of around 3,400 doctors, nurses, and other medical and logistical support staff, as well as more than 16,000 local staff members. As a politically independent organization, MSF is largely supported by donations from more than 3.4 million individuals and private donors throughout the world. Approximately 14% of the group's funding is nonetheless provided by a number of governments, including those of Belgium, Canada, Ireland, Luxembourg, the Netherlands, Norway, Spain, Sweden, Switzerland, and the United Kingdom. They have been known to work in 69 different countries. More than 60% of MSF's intervention take place in Africa, while the Asian region accounts for nearly 25% of its actions. They have been working in Haiti since 1991, where there was street fighting and a devastating natural disaster in 2010, followed by a cholera outbreak. They have worked in the Central African Republic because of armed conflicts impacting access to healthcare and provoking epidemics. There was a violent armed conflict in 2013 that has not yet been resolved, and MSF has provided health services. 70% of the health facilities have been damaged or destroyed, and there is a shortage of healthcare workers. They have on average delivered 18,000 babies, helped 10,000 malnourished children, carried out 7,000 surgeries and over 1 million consultations, most of which from malaria, and admitted 4,300 HIV patients on ARV treatment. In Nepal, they have provided emergency aid after the natural disaster, an earthquake in April 2015. They prioritized their action in the rural areas. MSF distributed 2,300 shelters and hygiene kits in the rural areas. They also installed water supplies and latrines. In Afghanistan, where there was an armed conflict, they have improved access to healthcare. MSF opened a hospital in 2011 to provide free quality surgeries to victims of the conflict. It has grown to hold 58 beds and where 16,000 antenatal consultations have been taking place and 1,400 babies were delivered. In South Sudan, there is also an armed conflict where epidemic diseases and healthcare exclusion have occurred. MSF has been working since 1983. They employ 3,000 South Sudanese staff and 330 international staff to provide quality healthcare. They have 17 projects locations. The number are impressive as they have provided 110,000 outpatient consultations, 32,000 treated for malaria, 65,000 hospital care, and 2,100 surgical operations, and 1,600 babies were delivered. In Syria, MSF began providing a mobile team of healthcare workers to 2 villages, supported by 2 ambulances. They have delivered 1,328 non-food item kits and 300 winter kits, which included coats, blankets, in 2015. They have been reinforcing immunization and monitored to prevent gaps to the assisted displaced people. It now has 23 health facilities and focuses on burns. Some statistics in 2015. MSF has assisted over 200,000 births, has provided more than 8 million outpatient consultations. MSF has rescued and assisted 23,000 migrants and refugees. It has also treated more than 2 million patients for malaria. MSF has helped 230,000 HIV patients to join the ARV treatment, and it has admitted 60,000 patients to malnutrition and programs. Even though MSF has been trying to be prepared and to create sustainable actions, significant failure to deliver humanitarian assistance has been noted in Syria, Yemen, South Sudan, Central African Republic, Afghanistan, Iraq, Somalia, and Libya. This is mainly due to access difficulty or insecurity operating environment. MSF has therefore created an emergency gap project to try to face these situations. Delivering healthcare services to displaced people is not easy and leaves a gap of service as the people move from one place to the other. Another difficulty is that as a humanitarian organization, one of the most difficult things to do is to avoid taking sides in the conflict. MSF has always been keen on connecting with nurses to work on their projects. They need nurses for vaccination campaigns, for triage, to operate feeding centers, or train local staff. There isn't much direct care, as the work is mainly about training, supervising, managing local staff. In conclusion, we can say that MSF is an impressive NGO that aims to help those in need. An interesting small video of an American nurse going on an MSF mission explaining her experience can be found in the following link, vimeo.com with the number that you can see. Thank you for listening to my presentation.